having children can be one of the most beautiful things that a woman does. Unfortunately, sometimes when it's all said and done, what's sort of left is not so positive. So I'm here with my friend. This is Dr. Patti Flint, and she is a board-certified plastic surgeon. Thought I would come here and maybe you could tell me sort of the options that mommies have. I guess we'd call it a mommy makeover?
That's right, Andy. It's a large part of my practice currently, and I think most women after childbearing are diligent at trying to work out and get their bodies back in shape, but unfortunately some of the changes in the skin laxity just don't bounce back with diet and exercise, and that's when it's time to consider a consultation with a board-certified plastic surgeon.
Well, does it matter how old you are if you're thinking of having a mommy makeover? I mean, I guess it would be the breasts, the tummy, and sometimes the back?
That's right. And age really isn't a big issue. It's more health history. So as long as you're healthy, not smoking, it's a good time to seek a consultation.
And trying to take care of yourself.
Absolutely.
Because sometimes, like you said, the more you work out, you can't stretch it back into place.
That's exactly right. Sometimes the gym just doesn't cut the mustard.
Right. I love it. Okay, so tell me about some of the options that you guys have here.
Well, I think most women after childbearing, particularly with breastfeeding, notice that they lose volume in their breasts. Mm-hmm. And when the glandular tissue shrinks, the breast tends to sag. So most of the women I see are seeking some sort of breast enhancement procedure, and it can frequently be a combination of procedures. So breast augmentation with a lift, or sometimes even downsizing of the breast tissue but with a lift to kind of get that pre-pregnancy shape back.
Right. And what about the tummy? That's called a tummy tuck?
Yeah, tummy tuck is probably the most common procedure done after childbearing on the trunk area. And what happens is not only does the skin stretch, but the underlying connective tissue that holds our tummy flat has to expand to allow the baby to develop.
Right.
And unfortunately, no amount of training or diet will snap that back into shape. So in a tummy tuck procedure, I'm tightening the abdominal wall so you don't have to suck it in anymore. It's actually an internal permanent girdle.
Okay, well, let's take a look at some of the before and after pictures, because I always like that. It really helps me sort of see exactly what you're doing.
Right. One of the patients I brought with me today to show the results was actually a marathon runner and still was unable to get rid of her tummy. So she had a typical combination surgery with tummy tuck and breast lift, and really felt that she finally was able to recoup the body she had prior to childbearing.
Well, let's take a look at the before and after pictures, because that's usually how you can really see those end results. I love it.
Sure thing. This is a photo of her. She's had 3 children at this point.
Okay.
And she has run 3 marathons this year and still has what she considers her mommy pillow on her lower tummy. I treat patients circumferentially, so they really maintain their harmony. We don't create imbalance, we create balance by treating you completely circumferentially around.
Okay.
So tummy tuck in the front, liposuction in the back, and back to pre-pregnancy, flat tummy, and a very happy patient. We also, at that point, helped her with some back fat that nobody likes by suctioning that area as well. And then because she breastfed all 3 of her children, we went in and did a breast lift and put a small implant in to help her retain the shape that she had prior to breastfeeding.
So I bet not everybody is the same. You take everyone individually, and there's some patients that are older than others that have mommy makeovers.
Absolutely. For a variety of reasons, some women aren't able to have these procedures done when their kids are still really little. And the next patient I brought is a gal that was very active in her 60s and had gone to the extent of losing 70 pounds to try to get rid of her mommy tummy, and it was ineffective. So she came to see me a little frustrated with the size and position of her breasts and her persistent tummy that hadn't responded to weight loss or 18 holes of golf a day.
Right.
And so she came to me in her 60s, and we were able to accomplish the same procedure in this patient as the last, which is a tummy tuck to flatten the tummy, some liposuction on the back, and then her breasts from breastfeeding and time and weight loss had descended onto her upper tummy, and she found them obstructive to her golf game and limiting in clothing choices.
And so she didn't actually want a, implants. She just wanted a little lift because at age, how old was she, 60?
62.
Right. That would just make her feel better.
Absolutely. And it's amazing how low, heavy breasts make women look heavier than they really are. So putting the breast back in appropriate position and regaining the shape pre-pregnancy is a very important part of this type of makeover.
I love looking at the pictures because it really gives a sense of the before and afters and what a difference it makes.
We have a lot of happy patients after these procedures.
Well, you've been doing this for how many years now?
I've been in practice 15 years this summer.
And obviously, you're a woman, you get it, you know exactly what we're going through.
Truly, I can relate to these issues on a lot of levels, and I really enjoy providing plastic surgery from a woman's perspective.
And it's very comfortable when you come in here. You have a lot of happy patients. So we're going to get more women to come in. Maybe they can grab their friends do a group mommy makeover.
Absolutely. We'd be happy to do that.
All right. If you would like to get a hold of Dr. Patti Flint, she has a couple of offices in the Valley. She's at 7301 East 2nd Street, Suite 200 in Scottsdale. And she also has an office out in Mesa at 1520 South Dobson, Suite 218. If you'd like to give her a call and make a consultation appointment, 1-877-91-FLINT or 1-877-91-35468. And you can also find her online at www.pattiflintmd.com. And we should mention that Dr. Patti Flint is a wonderful sponsor of Sonoran Living Live.